the quiet whispers of your grandchildren, the punchline at the end of a joke, the music of your favorite song. When you suffer from hearing loss, you miss the sounds that make life fun and fulfilling. But you do not have to miss out. At the JFK Johnson Rehabilitation Center for Audiology, a doctor of audiology will evaluate your hearing and recommend a personalized treatment plan to enhance the quality of your life. And best of all, today's hearing aids are small, are advanced in technology, and many are rechargeable so you never have to change a battery. Trust JFK for the highest level of clinical expertise and technical know-how available in the hearing healthcare field. If you want to enjoy all of life's moments again, call the JFK Center for Audiology today, conveniently located in both Edison and Monroe Township. Visit jfkaudiology.org. That's jfkaudiology.org. Or call 732-321-7063.
The information provided in the following program is not a substitute for or intended to be medical advice. Medical advice can only be provided to you by your personal physician.
Well, we are on the brink of a landmark surgical procedure that is going to be happening very soon with Hackensack Meridian Health JFK Medical Center. Hi again, I am Bert Barron. Welcome to another edition of JFK Spotlight on Health, the award-winning weekly program where we talk about the variety of services that are offered through Hackensack Meridian Health JFK Medical Center. Great to have you along this week, and we're very close to the 1,000th robotic surgery procedure that is happening at JFK Medical Center, Hackensack Meridian Health. And my guest this time around, general surgeon who specializes in oncological surgery. It is great to have Dr. Kumar Dasmahapatra with us this time around. Doctor, welcome to JFK Spotlight on Health. How are you today?
Thank you, and very good morning to you.
I think people think about robotic surgery, and they're thinking like, the Avengers or video games or real high-tech science fiction sort of stuff. There's nothing fictional about robotic surgery, is there, Doctor?
No, there's nothing fictional about it. It may be a misnomer, though, because a misconception is that, a robot is operating on a person. Actually, these are instruments which are inserted by surgeons, and the surgeons control those instruments, and those instruments are called robotic instruments. Yes, the surgeon is not standing next to the bedside because the surgeon is sitting on a console controlling the instruments. So the truth is that the robot is not operating on you, but the surgeon is operating the robot.
So it's almost like you take the knowledge and the experience of the surgeon, in this case you, and you pair it with this cutting-edge technology that is available today, which is just remarkable. And you bring these two together, and the end result is patient outcomes, increased accuracy, shorter recovery times. There's a lot of upside for patients who have robotic surgical procedures.
Yes. The biggest upside is that it is the latest technology. In my view, it is probably going to replace laparoscopic surgery in a few years. The technology is incredible. The preciseness of the surgery is great. The surgeon is actually looking at a three-dimensional view of a person's body instead of looking at a flat screen. So one can do a lot more with the robots than one can do with laparoscopic surgery. And the instruments really replicate the motion of the surgeon's hands and the surgeon's wrists, rather than the surgeon having to stand with instruments that are like 2 feet long and controlling it and moving it with the shoulders rather than the wrists, which is a much more natural way of doing surgery.
Just remarkable, like how precision that is, because sometimes when you think about something, I'm going to give this a very sort of street-level equation here. When you're at the boardwalk or you're playing a video game, and it's that claw that you pick up and you try to grab a toy with it. Well, when you move the little knob, the toy kind of bounces and it jumps, and it's not real pristine and not real clean. I'm imagining with the environment that you do these robotic surgeries in, if you make the slightest movement with your hand, it's replicated virtually exactly by the robotic surgical tools. Is that kind of how it works?
Yes, it kind of works that way. The movement of my hand and my fingers are replicated almost identical. The one of the advantages of the robot is that for surgeons who might have a slight tremor or a little shake, that the robot can pretty much eliminate that. And, that helps people, I guess, makes the instruments very steady. It is not, it does not replicate a surgeon's hand. So, yes, although the instruments are extremely precise, it can actually do work better than the surgeon's hand sometimes.
Is robotic surgery still in its infancy, Doctor, or is it a technology that's been around for a few years now?
the technology has been around for several years, and actually it all started historically, if I might take a couple of seconds to talk about it. It started really by the Army, thinking that they might be able to get technology where they can use in the MASH units where the surgeons can't get to the forefront, but maybe have a nurse or somebody who can put the robotic instruments in a patient and have the operation done maybe 50 miles away. And it has happened. There have been operations done from New York on patients in Paris. So these things have moved on to a point where we are now in the third or fourth generation robot, which is much smaller, which is much more precise, which is much more user-friendly, less expensive, and very, very accurate.
The technology is just remarkable. Is everyone who needs some surgery of some type or another, are they automatically qualified for robotic surgery, or do you see success with only certain types where it's needed?
No, at this point, robotic surgery can be done in almost anything that one does laparoscopically, but the data is not out on every procedure. The data is certainly out on doing hernia operations and maybe colon surgery. The reason for that is it is still very expensive. It costs $2 million to buy a robot, and each instrument can only be used maybe about 10 times. So it is expensive, but in the long run, we save people downtime. Patients are going home in 1 day or 2 days instead of staying in a hospital for 10 days and getting back to work much faster. They are able to take less pain medication, and we can talk about that in a little bit. But certainly there is no way to tell anybody at this point that a robotic is replacing surgery. No, open surgery is still very much done, and laparoscopic surgery still is much more commonly performed than robotic surgery. But I think as surgeons start to learn this, and it is a very steep learning curve, when they start to learn this, they find that this is much better than laparoscopic surgery. And I think at some point it may replace laparoscopic surgery, but probably will not replace all types of surgery.
Talk about the significance of this 1,000th procedure. I think about the Rutgers women's coach who won her 1,000th game as a coach earlier this year, and it was quite a significant milestone. 1,000 robotic surgeries is also significant, right?
1,000 is a great number, considering that 3 years ago we started this program in JFK. And maybe for the first year we did about 20 cases. But, as things have come along and we have more and more surgeons learning how to do these procedures, the growth is exponential. And we started off with one robot, and within 3 years we had to buy a second robot. And I'm pretty sure that we are at a point where we might be thinking of getting a third robot. And
this is as the demand continues for the robotic surgery?
The demand is starting to surface. Mostly, when I see my patients, I tell them, look, I'm going to do this robotically. So they kind of look at me and they say, well, what is it? So it's not like the patients are coming into my office and saying, look, I want this done robotically. No, they're not saying that yet. But I think as the word gets out and as results come out, as evidence shows that this is going to be better, I think that's when the general public will understand what this is all about.
Yeah, very exciting stuff this time around on JFK Spotlight on Health, talking robotic surgery with my special guest, Dr. Kumar Dasmahapatra, who is with us here. We're going to come back. We'll talk more about the patient benefits with robotic surgery and also some other things that are happening at JFK Medical Center and Hackensack Meridian Health. Stay right there. Much more coming up. Welcome back to JFK Spotlight on Health, the award-winning program. I'm New Jersey Broadcasters Association Radio Hall of Famer Burt Barron, joined by Dr. Kumar Dasmahapatra this week, and we're talking about the 1,000th robotic surgical procedure that is coming soon to JFK Medical Center. He's a general surgeon specializing in oncological surgery, and there's a special event that's happening this month, a special recognition that we're going to talk about as well as we make our through the program. By the way, for more information about any of the topics that are covered on this program, you could always visit the main website, hackensackmeridianhealth.org. In the previous segment, Doctor, we talked about the reduced need for pain medication and treating people for pain with the robotic surgical procedures. Elaborate on that, if you would, a little bit, because there's a lot of talk even today about treating pain and what patient pain means and the way that pain is addressed, particularly by the medical community. So can you talk about the benefits in terms of that?
Certainly. I think it is very appropriate to talk about that in view of the fact that we are all consumed in the media by opioid crisis. So when I first started doing robotic surgery, I was doing hernias, and I have been operating for the last 40 years. And my hernia patients, when I did them open or laparoscopic, they would be hurting for 7 months, me included. I had my surgery, and I thought I was going to die. So I did not know what robotic surgery would do, so I started seeing my patients after surgery. They would walk into the office. They were not clutching their groin anymore. They would hop onto the bed and hop back out when I told them that it was time for them to leave. What I found very, very quickly after my maybe 15th or 20th case is that some of the patients started returning the prescriptions that I gave them for Percocet or for other pain medication. And pretty soon, when I started questioning them directly, I found that over 90% of my patients who had hernia surgery did not take anything more than a few Advils or Tylenol. I mean, this was an incredible change in my practice where I was constantly giving out prescriptions after hernia surgery. And here we are with patients coming in, walking in with a smile, returning their prescriptions or telling me, look, hey, doc, I'm great. I didn't expect this. That has kind of moved on in the sense that now when I'm doing colon surgery robotically, and again, people stayed in the hospital for a week. They were on morphine or other narcotics, and we would keep them in the hospital with Percocet. What I'm finding is that my colon resections are now going home in 1 or 2 days. Sometimes even the most complicated left colon resections are going home in 2-3 days. And they are not taking any prescriptions with them when they're going. They're not complaining of pain after the second day. I mean, this is a major, major breakthrough for me and my practice. We are all talking about how can we reduce our length of stay and how can we reduce our opioid dependency. And here's a perfect example of technology coming to help out, where patients are not demanding pain medication like they used to for surgeries that they've had in the past.
That is remarkable that people are returning their pain medication because the recovery is that much swifter, and with that much reduced pain. That's really remarkable. And for you to say you experienced this personally, when the doctor, a surgeon says there's got to be a better way to do surgery, that speaks volumes right there as to how far this has come. That's really remarkable.
That's absolutely correct.
It really is. You had mentioned about some other procedures there, too. Colorectal Cancer Awareness Month is happening in April. This is a great platform and a great opportunity to kind of talk about the benefits of robotic surgery, too, and how it applies to that. You see some success with that, too?
Yes, I think that is my biggest excitement now. My practice is on to almost his 500th case. But lately, what excites me is the fact that when I'm operating on a patient with a colon cancer or for other reasons, in the past I would do them with a big, long incision that measured maybe 12 inches or more, or did them laparoscopically. But even laparoscopically, patients were not going home in 3-4 days. They were staying around for 4 or 5 days or longer, and they did have pain. What I'm finding with the patients who have colon surgery done robotically is that they are up on their feet the same evening or the next morning. They are hungry. They are waiting to eat. They're up and about. Very rarely are they taking any narcotics on the second day. Their bowel functions return within a couple of days, and they're home in 2-3 days, which is just phenomenal. And I can't tell you how excited about that I am. And in fact, I would probably recommend robotic surgery as my first choice now to patients. Technology has come a long way where we don't have to even open up to put the bowel pieces back together with staples. We can do all of that inside the belly without having to make any big incisions. That
is remarkable. And I could just imagine, consulting with a patient who was having a surgical procedure done, and you sort of handing them a ruler and you say, see this? This is the size of the incision I used to have to make. Now I don't have to do that anymore. And right away, I'm sure somebody calms right down when they're facing a procedure like this. And it gives you a chance to kind of educate people before the actual procedure happens.
Yes, absolutely correct. When you tell them they're going to have 4 or 5 small 5-millimeter or 8-millimeter puncture holes compared to a 12-inch incision, I mean, their eyes light up.
Oh, I'm sure it does. And congratulations to you, too, because that's incredibly significant. We were talking about the 1,000th procedure with JFK Hackensack Meridian Health, 500 for you personally. Congratulations on that. And you've seen a tremendous swing, I'm sure, in your career as this has gone on over these 500 procedures.
Yes, it's been a very good experience. The learning curve has been very steep, but once you get to a certain level, you really feel that this is the way to go, and then you want to do everything robotically. And I think things are moving along, but I have to be a little cautious in the sense the evidence for benefit is slow in coming. It requires a lot of careful study. So although we all are very excited about it, one still has to pay attention to, so what is the evidence? Is this really helpful or not? Is it cost effective or not? So those things one continues to think all the time. You always want to become more efficient. You want to decrease the time that the patient is under anesthesia. So it is just not about technology. It is about how you use the technology to benefit the patients and you. And just imagine, I could be sitting on a chair with my feet up, doing my surgery with my little wrists, and I'm not standing there with a backache anymore. My shoulders are not hurting when I go home anymore.
Yeah, incredible. When you hear about some of these procedures that involve surgeons working in shifts because it's so many hours and so involved, this is really a game changer. It really is. And
Absolutely.
Before we go to our next break, Doctor, maybe you could educate me a little bit about something. I know that when someone undergoes a clinical trial for a medication or a medicine, there's a process that happens with a trial, and then it receives approval ultimately from the FDA before it is made widely available. For a procedure like this, is it something similar? Is it maybe a medical board that has to verify the data before it's available that much more widespread? When will we see this sort of take off?
Well, the FDA approves these things. Nothing is done without FDA approval in terms of equipment.
Okay.
So all that has been taken care of before it really gets out into the public. But at the same time, there are many, many organizations in surgery who present their findings, who look at data, who come to consensus. So all that is a continual process. There is no stoppage in us learning what's good, what's bad, looking at our results, looking at our failures. So that process is an ongoing process. There will be studies, I'm sure, comparing this to that, and there are many, many, many articles in the literature now stating the benefits of robotic surgery over certain types of laparoscopic surgery. That's out in the literature. But yeah, this is safe. Patients don't need to be concerned about the fact whether this is an approved procedure or not. Yes, this is FDA approved.
Excellent. We'll come back. We have one more segment to go with my guest, Dr. Kumar Dasmahapatra. We're going to talk about his work in the oncological field and the role that robotic surgery plays in fighting cancer at JFK Medical Center, Hackensack Meridian Health. And we'll do that for you and wrap up the show coming up next.
I'm Michael.
And I'm April. We're husband and wife, and together we lost nearly 200 pounds.
Do you want to know our secret?
We both went to the JFK for Life surgical weight loss program.
JFK for Life is a comprehensive weight management program specializing in both surgical weight loss and non-surgical weight loss. Your journey will include an entire team of clinical experts located close to home, remaining with you for ongoing encouragement and support. From nutritionists to fitness counselors to board-certified surgeons, we know it's not the amount of weight you need to lose. It's how your life will be different once you lose the weight. JFK for Life has been recognized as a Center of Blue distinction from Blue Cross and an Aetna Institute of Quality.
Why wait? Lose weight.
Visit jfkforlife.org today.
Learn more about JFK for Life and the success of more than 1,000 weight loss surgeries performed. Visit jfkforlife.org and watch our free weight loss seminar at your convenience.
Time has flown by once again on this week's edition of JFK Spotlight on Health. I want to thank my special guest, Dr. Kumar Dasmahapatra, for being my guest here today. General surgery, specializing in oncological surgery, and of course, as we mentioned, with Hackensack Meridian Health JFK Medical Center, approaching that landmark 1,000th robotic surgery procedure, and 500 for the doctor who was my guest here today. So congratulations on both fronts there. Doctor, I spent a lot of time volunteering on boards across our state for breast cancer research and for pediatric cancer. I do a lot of volunteer work and spend a lot of time working with groups that are fighting this. Talk about your role and what robotic surgery means when it comes to the oncology surgery world, and if there's upside to there.
Certainly, there's a major upside to that. So, yes, I am a surgical oncologist, and my training is as a general surgeon, but I specialize in cancer surgery and all kinds of major complicated cancer surgery. All that had been done up to now by making big, long incisions and spending 6-8 hours and doing things. So a lot of that has changed. The robot has changed a lot of that. I just told you how it has changed my approach to colon cancer. Similarly, it has done wonders for patients who have stomach cancer. There are robotic applications to patients with pancreatic cancer. In fact, the Whipple procedure, which is a very well-known procedure, which is considered the absolute complicated procedure that a resident can learn, people are able to do a Whipple procedure and take out a patient's cancer from the pancreas using the robot. Not everybody's doing it. One requires a little expertise, but there is no limit to what one can do in the abdomen. There are thoracic surgeons taking out lung cancer, taking out the whole lung or part of it, putting tiny little incisions between the ribs rather than, removing a rib and making a big, long cut in the chest. I mean, how exciting is that? Where patients can come in, get their lungs removed, and in a few days they're home without really the pain, the discomfort, the big, long scar. So I think that is all very exciting. So all cancer applications in the chest, in the esophagus, which is the food pipe, the stomach, the pancreas, the small intestine, the large intestine, all those cancers can be approached using the robot at this time.
It's really incredible. How many procedures on a typical week, doctor, do you perform?
I perform about 15 procedures a week myself, but robotically it varies between 5 to 10.
And I'm sure the robotic procedures have really saved you a lot of time and have given you the chance to work with even more patients because of the efficiency.
Oh, without a doubt. I think, not only that, at the end of the day, I'm not wiped out.
Yeah, that helps too, right? If you could just talk a little bit about the visuals from your perspective when you're performing a procedure on someone using the robotic tools and whatnot. I'm wondering what exactly it is you're watching. Is it like a virtual reality headset, or you're watching like a giant screen, HD TV from someone's man cave? I'm just, from your perspective and your experience, what this is like when you're performing a life-saving procedure on someone.
So I think that is the most exciting part of robotic surgery. No, you're not watching a 60-inch monitor. You're not watching a virtual headset. You're actually looking into a screen, and because the camera that is that's in the robot has two lenses, what you're watching the screen is a three-dimensional representation of what actually is happening in the body. It is extremely accurate. It is extremely magnified in the sense you can see little things that you couldn't see with the naked eyes. It is like, picture yourself walking into somebody's abdomen, and you can just stand there, look around, you can gauge the depth, you can gauge the distance without having to estimate it. It is you can look behind organs. You can use your camera to look at things that you could never see with a laparoscopic camera.
And I'm guessing that this even reduces, you talked about the physical fatigue sometimes of performing procedures. The eye fatigue, I would think, would be reduced a little bit as well with these very pristine and very crystal clear views that you have.
Without a doubt. I mean, imagine you're looking at a screen laparoscopically, which is maybe 6 to 10 feet away, and here you are looking at something right there in front of you.
It's just remarkable. Where would you like to see this advance, these surgical procedures, these robotic surgeries, doctor?
I mean, every day.
What's the next field?
Techniques coming out.
Mm-hmm.
There are robotic applications for orthopedic surgery. There are robotic applications for some head and neck surgery. The technology that is probably about to break through is the fact that when we are operating on the robot, imagine we are about 20 feet away sometimes, and what we feel with our hands and the instruments are not necessarily what we would feel in open surgery. I can't put my hand in the belly and feel something like I used to in open surgery. But I think with time, the technology can start giving you a feedback of touch that exists today. And I think that is going to become very popular, and that is going to make the surgeon's life much easier. Today, when I'm operating, the technicians there tell me I can't feel it, but when I'm hitting bone, believe me, I can feel it.
Wow!
So the brain gets rewired.
Interesting, and it takes me kind of back to growing up and going to metal shop when I was in school, and we had this digital measuring device, and I can remember asking my teacher, I said, does this measure any more accurately and says, no, it just makes it easier to use. Your hands are still responsible for doing the measuring. So it's the same thing with you. I mean, you could have the greatest robotic tools in the world without the touch that a surgeon, an advanced and experienced surgeon like yours has. That's how you maximize this technology here.
Absolutely. And that is the next step that's coming through.
All right. Very interesting stuff today. And again, if you'd like some more information about the topic that we discussed, you could always visit the general overall website with Hackensack Meridian Health. It is hackensackmeridianhealth.org. You can read about the wide array of procedures that are available there. And, of course, you can always listen to this program, too, in the library of podcasts that we have available on this great website, too. About a minute or so left to go, Doctor, and just some final thoughts from you on what you've seen from this. And again, a little bit about the 1,000th landmark procedure that's coming up.
Yeah, we're very proud, as I had mentioned, about the 1,000 cases that are coming up. Nobody in JFK Hospital could have seen that coming 3-4 years ago. So we're all very proud of the team that we have working with us. They're very dedicated, and they're very excited to be a part of this 1,000 procedure that will be done soon. In general, what I would just tell the lay public is that this is not something you need to be scared about. It is not a robot that is doing a surgery. The surgeon is intimately involved in every little thing that happens in this procedure. And hopefully, as time goes on and as technology keeps improving, this will become safer and safer, and there will be many, many more applications to this.
And that's what we want for everyone, exactly. Dr. Kumar Dasmahapatra, thank you for being my guest here on JFK Spotlight on Health, and hopefully we can talk to you again soon, all right?
Thank you, Bert.
All right, I'm Bert. Thanks so much for listening to JFK Spotlight on Health, and until next time, you have a healthy day.